Hello and welcome to Healthy Knees for You. My name is Robin Robertson and I am here today with my friend and surgeon, Dr. Thorpe. And we're going to be talking about what implants are made of, what they look like, who makes them, and what your options are when you are thinking about a total knee replacement. I'm Robin Robertson, founder of Healthy Knees Coach and international best-selling author. I figure I was born with a crappy pair of knees so that I could help you avoid the mistakes that I made and benefit from the many successes I achieved in my long and sordid knee history. Fast forward past multiple knee surgeries, ultimately with both knees replaced. Plenty of life experience and study into the latest research for knees, and I'm stronger and healthier than I've ever been. I want to help you get there too. I share these lessons with you that will change your knees and probably change your life to give you the strength, stamina, and stability to get back to doing the things that you love. If you suffer from knee pain or want to avoid it altogether, you are in the right place, friend. Let's get started. All right, so I have my Conformis custom knee here. But before we get into all of that, I want to let Dr. Thorpe tell you a little bit about his past and how the two of us are sitting here together.
Well, as you know, I grew up in Iowa, and I went to Drake University on a basketball scholarship, but also threw the discus and played volleyball.
Oh, I didn't know that.
Yeah, those were my three sports. And so when I finished college, I went to the University of Iowa for medical school for 4 years. And then escaped Iowa, came out to the University of Washington for my 5 years of orthopedic surgery training. And I completed that, I came straight to Bellingham to open practice here in 1988. So, and then retired January 1st of 2021. And like I said, I am a father of 5 and a grandfather to 10.
Yes.
So that's my full-time job now.
That's so fantastic.
Yeah.
And he actually is my surgeon and friend. Became a friend through all the surgeries.
Yeah.
Of my 12 surgeries, Dr. Thorpe performed 10 of them. And I was so well cared for that I just really cherish the time that we get to spend together as friends. And I'm glad that he's no longer actually looking at my knees.
Yeah, and now you talk to me rather than when you're asleep on the OR table.
Yeah, right. Okay, so we're talking about the total knee replacements and how to know what your doctor is choosing for you. So let's just talk about the pieces of total knee replacement and how they fit in. And I'm going to hand these over to you so that you can show them a little bit better.
Okay.
And what each piece is made of.
Okay. Well, there's 4 basic parts to a standard knee replacement. The femoral component, so this is the end of the femur. So basically, a lot of people think we just lop off the end of your whole femur, but it's a resurfacing. So as you see, this femoral component just resurfaced the end of your femur like that. So if you were standing up, it'd be like so. So that's the femoral component.
And so it's kind of like a cap over the end of the bone, right?
It caps the end of the bone, right?
Yeah.
We trim off roughly a centimeter of the bone and replace it with metal. Yep.
And you can see that there's a lot of cuts here along the way. And so it's roughly keeping the shape of the end of the femur, which looks like this.
And it's a nice geometric fit, so it helps lock on.
Oh.
We cement those on, this type. There's also cementless, where the undersurface of the femoral component would not be this smoother metal, but it would be mesh, much like the cup of a total hip or the stem of a total hip, where bone grows into it.
I didn't know that.
I've done some of those too. And the trend is moving more towards cementless knee replacements.
Oh, interesting.
And then on the tibial side, so this would be the shin bone here, the tibia, and so we trim off the top of that flat with the floor. If the person was standing, you shoot for flat, give or take 3 degrees is optimal. It'll even, they've shown that a cut at 5 degrees off, still the results are the same. So there is some forgiveness there.
Wow, okay.
But we shoot for straight. And then you see the cut surface of the top of the tibia, and we drill a hole down in there for the end of the implant has a stem and some fins to help control rotation and tilt and all. We call it the keel. And then you cement that on, or more recently they're going towards cementless, where you would put it down on there and put some screws through the metal plate and secure it on the bone and hope that the bone grows into it.
Interesting.
And then once you've got those secured in place, you've got a plastic spacer. Now this custom has 2 plastic spacers. A standard off-the-shelf type would just have one piece like this that snaps on to the tibial tray. We call it the tibial tray, and that just snaps on like that. And so it's never metal on metal. It's metal of the femoral component, which is cobalt, chrome, molybdenum alloy.
Oh,
And
that's a mouthful.
yeah,
Cobalt, chrome, molybdenum
yeah,
alloy.
it's another metal. And sometimes there's a little nickel in there too. But so that's the femoral and the tibial, and then of course you have your kneecap, which I always replace. I always resurfaced. So this is the end of the kneecap, and
yeah, I never saw that.
It would fit on there like so. And so, you know, your kneecap is suspended in your quadriceps tendon and patellar tendon to here, and it doesn't move. You bend like that, and your kneecap stays in place. See, it just tracks in that little groove that's right there. So I would always replace that. And the back to the metal first, the tibial tray. Many tibia companies are making their tibia now out of cobalt, chrome, molybdenum alloy too. We just say cobalt, chrome, but because it's very hard metal, very shiny and smooth, and therefore any micro motion, even though this plastic snaps onto the tray, there's a little bit of motion microscopically. Okay. And if this happens to be titanium, which is the other type of metal, titanium aluminum alloy, you get a little wear debris.
Oh.
And you'll find little tiny particles of that titanium, and it'll stain the tissue kind of gunmetal gray a little bit. So to avoid any corrosion and wear on the plastic and corrosion on the metal, most companies are now making that out of cobalt chrome.
Yeah.
Yeah.
And these are kind of heavy. I mean, this is actually what it weighs. Mm-hmm. No wonder I gained weight after my knee replacement surgeries.
I know when women would ask me, now, how come I'm weighing so much more now after surgery? And it's usually water weight that you've gained, but I always thought, well, the implants are like 10 pounds.
Yeah.
Just so they felt better.
What I thought, yes.
Yeah. And then the plastics here, this is ultra high molecular weight polyethylene. So, and the technology on making these plastics greatly improved from the 90s, where this would flake and particles would come off, and you go in to do a revision and you'd be taking out chunks of plastic. And, yeah, and now the plastic wear is very minimal.
Okay, that's awesome.
That helps them last longer. Yeah.
So tell us the difference between a custom knee like this one, and for this, the company that did mine, and this is a model of my knee, is named Conformis, and so I had a CT scan 6 weeks ahead of time, which mapped out my bones, and then they have this really cool 3D printer that creates the bone itself, or the replica of the bone, in order to use that as a model for the implant. So the fully custom knee is designed only for my knee. I felt really good about that. But before we get into why you would want a custom versus an off-the-shelf, tell us more about the off-the-shelf. How many types are out there? How does a doctor pick which one they're going to use?
There's many different companies that make knee replacements. The 2 biggest are Johnson & Johnson, DePuy. That's the one I used. The Johnson & Johnson and DePuy were 2 companies that merged. One had what I thought was the best hip. The other one had the best knee.
Okay.
I was one of their fans, so I used their components almost always. Zimmer and Biomet joined.
Okay.
And they have very good products also. And then there's other ones that in regions of the country have more prevalence of one than the other. It's kind of what the docs use, where they trained and what they used.
Okay.
And so Stryker is another one. Smith and Nephew is another company that make them, and Wright Medical. There's several, but
And they're all generally either cobalt chrome or titanium?
yeah, and then the plastics are polyethylene. Now, one company I know of makes a nickel-free, in case people have nickel allergy.
Yeah.
They make an oxinium femoral component so that you can avoid potential. It's super rare. Some people don't even believe in it, but a nickel allergy.
How would you know if you had a nickel allergy?
Yeah, if someone's got a topical allergy to nickel, that doesn't correlate to a deep allergy at all. So that makes it really hard. There is pre-testing, pre-surgical testing that a immunologist can do, an allergist, but
How would you even suspect that you have a nickel allergy?
well, most people came in and told us, that nickel would cause a topical allergy.
Okay.
And most of the time I would say, well, that's highly, highly unlikely. In my 33 years of practice and 5 years of training, I only know of one person out of hundreds of thousands of joint replacements, that I've been around, to have had a true allergy that required revision of her knee replacement. So it's pretty rare.
Okay.
But, if someone really has had metal before put in, say, plates, screws that have nickel in them, and they responded to that adversely, then you'd better take it seriously.
Right.
Too. Yeah.
Okay.
So anyway, a standard, as we say, off-the-shelf knee replacement has multiple sizes. Like sizes 1 through 10 or 2 through 8. Or so, the ones I used, we almost never used, I never used a 1. That might be a small little Japanese lady.
Oh, yeah.
Tiny. 2, I've used a few 2s, not many. Most of the time they were 3, 4, 5 on up. Men, you'd be up there 6s, 7s, 8s, things like that.
Okay.
So there's multiple sizes, and you measure intraoperatively. So you've got little devices that tell you the front to back dimensions of the femur. So as you're doing it, you've got the knee open and bent like this, and you can measure this thickness of the knee. You can see the width here. After you've made your tibial cut, you're looking down on it, and you've got little templates to put on the cut surface to see if it's a size 6 or a 7 or an 8, and then based on that sizing, the jig you use to prepare the bone for the implant is picked. So
you in the operating room, you've got several sizes that you can choose from.
Yeah,
so they're prepped and ready to go.
All the actual parts that we would cement in or screw in are in sterile boxes.
Oh yeah,
off to the side. But on the operating room table, we have trials that jigs and then trials we can put on, make sure everything tracks right and fits right before we actually select the real one to put on.
Okay.
So these the off the shelf you can template ahead of time with your computer. You can look at the X-rays and move a template over and say, Mrs. Robertson looks like she'll be a size 4. Femur and a size 4 tibia, or it could be a 3 tibia and a 4 femur. It doesn't have to match.
Oh, okay.
Exactly.
So it's not like one box knee.
No,
you can mix and match
up to 2 different sizes.
It's like a bikini. You can mix and match the top and the bottom.
Yeah. I say if you wear a size 4 dress, you'll probably have a size
4 leg.
If you're a size 16 dress, you might be a size 10 femur. You never
that's
know.
interesting. Okay.
Yeah. I usually use that line when they ask how big my incision's going to be.
Yes.
Depends on your dress size.
Right.
But
okay, let's talk about that. Actually, the incision styles. So I know there for a while was what was called the minimally invasive surgery versus the sort of the regular front of knee. I've got 2 beautiful scars that run over my knees for my replacements. Let's just talk about that a little bit, what that means to have a minimally invasive knee surgery versus the classic front of knee.
Okay. Well, I kind of laugh a little bit when use the term minimally invasive, because regardless of how you get in there, you're still cutting the end of the femur off, top of the tibia off, the back of the kneecap off. I mean, it's still invasive, right? So basically, I think it was, the term minimally invasive was more for marketing. You know, if you could get the public to come see you because you were minimally invasive, it sounded better, right?
Yeah, it does sound better.
Yeah, it does sound better. And it is true that some surgeons, you know, make an incision a foot long on the front of your knee. Totally unnecessary. But that was the old school. Incisions didn't matter, and you know, you just did what you did. And so I think that movement did get people to shorten up their incisions just for cosmetics.
Okay, well, that's good.
It's mainly cosmetics, but you know, it does take, if you make a long incision, it does take longer to close, and the patient's therefore in the OR,
Interesting.
asleep longer, exposed to the anesthetic. The cost goes up because time in the OR is
right.
cost. You know, all that. So I said, I'll make the incision the size I need to do the operation.
Right.
And that's it. And so my incisions over my 30 years did get shorter. They
Did
really
they?
did. Oh yeah,
Okay.
they did get shorter. I got faster, you know, but I can't say it's minimally invasive.